and feeling through your hands. There's so much blood and oxygen pumping through your brain. It's like rocket fuel. Right now, you could run faster and you could fight harder. You could jump higher than ever in your life. And you are so alert. It's like you can slow down time. What's wrong with scared? Scared is a superpower. It's your superpower. There is danger in this room, and guess what? It's you. Do you feel it?
That was Peter Capaldi playing the titular character Doctor Who from the well-known British sci-fi series. Oh, and before you at me on Twitter, I know his name is the Doctor, but you can call the character Doctor Who. There is precedent for that in the series. So back off, nerds. Actually, you can at me on Twitter if you want. I'd really like to have that conversation. I'm one of you nerds. It's okay. We're friends. That comes from a famous episode of the show called Listen. It's episode 4 in series 8 of Doctor Who. This theme emerges with fear being portrayed as a form of a superpower or an ability to be respected instead of, well, feared. There's more dialogue later in that episode from a different character, the Doctor's traveling companion, Clara, where she says fear is a superpower. Fear can make you faster and cleverer and stronger. And one day you're going to come back to this problem. And on that day, you're going to be very afraid indeed. But that's okay, because if you're very wise and very strong, fear doesn't have to make you cruel or cowardly. Fear can make you kind. We're going to talk about fear today. We're going to talk about the fears that keep people holding back from engaging in treatment. Getting treatment and getting into a more sober and healthy lifestyle can be very, very scary when you have been opioid dependent or when you have been lost in addiction. Many of you out there know that as you listen to this program. Many of you know it so intimately that you might even be in the throes of that kind of fear right now. One of the reasons that we present this information here on the Wiseman Method podcast is that we want people to be able to make well-informed, wise decisions about their own treatment and their own course of health management. So this is going to be an important discussion in that way. I predict you're going to enjoy quite a bit. So let's get into that with Claire Wiseman, David Livingston, where we talk about the effects of fear. Claire, you were saying how fears are different for different people when it comes to being afraid to enter a treatment, right?
Yeah, I think especially based on where they are on, their substance abuse. I think it's different for those who never seek treatment before and those that have been through numerous treatments. I think the fears are very different. I think also, based on the age and social level of people, I think fears are also different. So that there are a number of factors. I think if we want to start with people that, maybe not just realize, but that they have a substance use issue, but just realize that they do need professional help. I think that's two different realizations. And for those that just realize and never had that issue before, I think one of the biggest fears is being labeled. Being labeled the rest
that's a good point.
Of their lives.
Yeah. I think that's a really good point. People fear that. I think one of the things that I've noticed, and there's no rule for everyone who gets into addictive behaviors, but I always say that people who are at risk, one of the groups of people that are at risk for dependent addictive behaviors are people who actually have really big hearts because they're sensitive and they get worried about letting people down. And then, of course, with the addictive behavior, they do let people down and then they hide it. And it's terrifying for many people to have that dynamic. And so that being labeled, I think goes along with that fear of being labeled. I don't know if you guys see that on your side of things.
I do, but I was going to see that as a secondary issue, of letting people down once they got treatment. But I think the first thing they have to say is, wow, I cannot handle this on my own. I need professional help. And that's even before the fear of not, achieving full recovery. I think is truly being seen first by their families and friends, and second by society as, a word I hate to use, as an addict, or as, a person that will need to go to a rehab. I think there's a whole sections and terms in this bucket, drug addict, somebody that needs to go to a rehab, somebody, with substance use issues. And I think once you say that out loud, it puts you in that bucket of all those terms all around you.
Well, you're absolutely right. I think that even just that identity, first of all, there's the shame, right? But also just being able to say, even just saying out loud, I have a problem. This has gotten out of control. I think there's the fear sometimes of letting people down, as well, of saying, I'm going to go into treatment. I'm going to dedicate time and money to clean up, especially as you pointed out, for some people, it's the first time and they don't know what they're doing, or they don't know what it's like. For other people, it might be they feel like they're in a revolving door and they've hurt their spouse, they've hurt their kids, and now I'm on that track again. So I see those.
No doubt, but that's why I was, separating those who never received treatment to those who just realized that they need help, substance use. I think the shame and the hurt and everything else are usually more for those who have been through treatment numerous times because of the fear of being labeled. Does that make sense?
Yeah, so avoiding the label, it's kind of like kicking the can down the road further in a way, right? Of saying, I want to avoid that label, and so I won't take care of it, and then of course it just can get worse.
On one level, we're just talking about getting off some chemicals. On one level, that's a reality. There's some chemicals that are causing problems. You just got to get off the chemicals. And once you're off the chemicals, everything else can be worked at. And to see it as simply as some chemicals that are screwing up your life that you got to get off of is really important, because the overlay that is there, and look, and so when you simplify it like that, often people feel like, well, you're not addressing all these other things. And to some degree that's true, because you have to go one thing at a time, right? And so the first thing is you have to address the need to get the chemicals removed, and then you've got to understand how they were helping and how they were destructive. Because one of the biggest problems, and one of the reasons for chronic relapse, is that nobody goes into why people like them and why and how they actually do help. Okay, so it's easy to sort of go in and everybody leads with how the ways they're destructive, right? But there's also benefits as coping mechanisms. Now, they end up not being effective. They don't end up working, which is why it's a neurotic cycle. It doesn't lead anywhere. But initially, there are needs that have to get addressed, and if those needs get addressed, and there's a sense of you seeing them as a human being, like a whole person who's struggling with some aspect of their life, then generally the fear goes down. But it's hard for people to kind of parse all of that. It's hard to do that in a treatment. It takes time.
It's really an interesting idea. You're mentioning what a lot of people I think would call a strengths-based model, where you're trying to balance out you use the opioids for a reason, right? There's a goal-directed behavior, which, as you put it, it becomes very unhealthy. But acknowledging what someone's trying to accomplish, a lot of times what we're trying to accomplish when we get into addictive stuff is not bad. If I want to feel good, if I want to escape pain, if I want to pain in the form of depression sometimes, or those are good desires. It's just the doing and the method that can become unhealthy, right?
That's it, right? So there's neurotic suffering, right? The suffering that leads nowhere compared to sort of existential suffering, the suffering that leads to something better. Ultimately, part of a treatment is it's like working at anything. It's work. And so there's a part of it that feels hard. But when you really start to feel the other side of it, when you can see the benefit and you can really start to do that, that's when a treatment really starts to take hold. And often it's only parsed as an addiction, meaning this is the problem, and and it's so oversimplified that it's not necessarily good. Even though some people struggle with sobriety, it can become so severe that does become sort of the overriding concern for many people, maybe even most people. It's not necessarily the case.
I know we've talked before about how once someone goes through the detox process, that's when there's a lot of work that begins at that point, right? And what kind of fears pick up after they've gone through a detox process?
I see the fear persisting if they are convinced that that bucket exists and that everybody is part of the bucket I was speaking of. So oftentimes they have drug counselors that will tell them that relapse is part of recovery, that they need groups because their cravings will lead them to use opioids, or they have to create an abstinence of anything that can cause any mood alteration, sometimes even, antidepressants. So,
I think that can be very dangerous.
Of course it can. So when people are put in that box, I think they feel such a hopelessness, such a sense of, defeat, that whatever sacrifice they did to achieve sobriety, they will never be considered sober or part of normal society. And I think that's absolutely horrible. And as David was saying, it is truly just and is everything. But detoxification is truly just the use of a substance without being able to control. So that can be reversed without any major issues and without any long-term commitment. But whatever reasons the substance worked for, if it is chronic pain or if it is emotional pain or if it was a way that person found to deal with whatever distress they were dealing and help them get through that distress, we need to separate what the physical dependence is, what the root issue is. And again, we fall back on the same, conversation as always. And what treatment should be and what treatment providers is not even offer, should promise or not.
There's a fear that you mention and touch on, which is not being accepted back into a society. And sometimes that's a family or a faith community or a job even, or a profession. Sometimes there's just that fear. And I hope the stigma is getting better, but there's that fear of being like, I am the bad guy, right? I am the addict. I am the one that is broken, and I won't be able to achieve a full-fledged citizenship of whatever societies I'm a part of. And being that person because of the things that we've done in the course of addictive behavior or other things like that, I'll never really be considered okay.
There's always, somebody serving wine or saying, be careful with that person. Well, that person, it's Mary that again is, 76 years old and had 4 hip surgeries and went to detox. Mm-hmm. But Mary never had a problem with alcohol or drugs in her life. But then there is that, be careful offering her, be careful drinking beside her. It makes that person this fragile, individual that everybody's walking on eggs around. And that's not a pleasant place to be.
Well, right. So you might say that fear needs to operate correct. One of the things that I ask the patients as they're coming through when I'm talking to them, or I try to notice, is I'll ask them if they felt afraid, when they were taking, and what they felt afraid of. And because fear is the greatest inhibitory factor we may have, right? So when we feel fear, right, not an intellectual idea, but when we feel fear, it inhibits us. So often what happens is that you'll see people that everything around them, or the people around them, or there's fear of, how they're going to be accepted and all these other things. And then they use the drug compensively, or to compensate for all these other things. And they don't actually fear the dangers that are inherent in the use itself, or the risks they're taking. Now, we all feel fear appropriately, right? Because when we fear something, we're far more likely to pause, put the brakes on. And it's probably the most, or at least one of the most protective processes we have. And so one of the things that happens when people are on opioids is they don't feel much at all, which is why people, when they get off of it, right, and then they think they can go back and take one or just this or that, they can't, because not only does the reward system get triggered in the brain, but also the inhibitory system of fear gets lessened and lessened. So there's no fear, there's a reward system going, and people end up relapsing. So to keep fear alive in the correct way, right, to know what is not good for us is also critical. So fear has so many roles in this that's significant.
We've talked about things like pain. We've talked about happiness and anger. What do you think are some of the healthy uses of fear?
I think fear at the right level is a protective feeling, and I think it's extremely healthy. It just, needs to be at the right level, that warrants a response. Does that make sense?
Yeah.
So, totally. Right. When I ask someone if they feel fear and they say they don't feel any fear around it, I immediately say to them that worries me immensely for you. Right. So, because that's a dangerous idea to identify with. Right. And I think there's a lot of confusion just in our society about the word fear. It's as if it's something to just overcome always, rather than a immensely important part of our sense of wisdom and like Claire's saying and you both saying, to how to protect yourself and how to gauge what's healthy and what's not.
Sort of like hyper awareness is oftentimes associated with fear or with anxiety, and that could be sort of that's one of the superpowers of fear in a way, right? Or also one of the big pitfalls too, if it spins out of control. But you're kind of talking about an appropriate, enhanced awareness of what's going on. In a way, it's a balance,
right?
Where there's you talked earlier about the fear of relapse, which I would call that to say, relapse is an inevitable part of my recovery, which people are taught, and so then there's that maybe unhealthy fear, right? It's an unhealthy fear of relapse versus perhaps more like what we're talking about now, which is to say, yeah, I got to be careful, like don't overblow it, but it's like, I should have some appreciation that it could happen if I'm not careful. Right? There's the healthiness versus the overwhelming.
But I think if we go back to the subject here of the fear of treatment, I think most of these fears are due to fake promises. Mm-hmm. When people seek treatment for, or an opioid dependence or an opioid addiction or mental health issues, those are very, very different conditions. And I think the fear that most feel is because most people will fail not because they failed, because they were overpromised. And I think when you talk, if you talk about fear, the feeling of fear itself is what we're talking about, and the fear towards treatment is different things. The fear towards treatment, I believe personally that more and more group treatment will become obsolete.
Wow. So you feel like you will see less of that as the medical kind of focus gets?
I think there's going to be a focus, on a dependent that should be treated by physicians, especially when you're dealing with alcohol. That is, an extremely dangerous detox. And I think then you have the mental health condition, the emotional condition, whatever that is. And that needs to be treated not in 30, 60, or 90 days in most cases, but on long term. And what one person needs is not necessarily what other needs. And often we see young patients coming in that are so broken. And, they do have personality disorders, and they do have, severe emotional issues, and putting them in a rehab is not effective. It's even cruel. We see that often. We also see the person that doesn't have an emotional issue, but they do have opioid dependence due to whatever medical issues they have. So again, having everybody in the group hold each other's hands and, telling themselves how weak they are, how broken they are, how unprepared to deal with life they are, and how fragile they are to all those monsters that live around them, in a way cripples them even further to face life on life's terms.
I remember when I worked for a community mental health facility, there was an inpatient and an IOP program where people would come in all day or they'd live there for a while. And in that treatment program, the clinical director had to kind of sort of bust the program staff because a couple of them were the very, very, very old school kind of mentality, to where the mentality was, give the patients a kick in the ass and then they'll get sober. And they had problems like somebody had to wear a sign with their character trait flaws on it. And sometimes they were things like that. And so thankfully the clinical director came in and said, you got to knock that off, and I think you get into the old school mentality where it's like, if you can, get tough, then someone will stop. And my personal experience is that a lot of them had trauma, or like you said, maybe they have personality disorders, and they will respond to the right treatments, but they won't respond to that in a healthy way.
The basis for treatment is listening. The purpose of listening is to learn and understand who you're working with and to really see them for who they are, and really understanding how someone's experiences have shaped them, what their strengths and limits are, how they're organized as an individual. All of these factors are critical in understanding how to go about helping them. None of that is taken into account in most of the treatment modalities that whatsoever, in fact, not even considered. And to the degree that people are struggling with dealing with trauma, you would have to deal with trauma over a very, very, very long time. And you would not want to detox somebody and open up their trauma simultaneously. That would be too much for anyone. A lot of what trauma is, someone being overwhelmed by something that's not good for them. So the essence of treatment is to move at a pace and with an understanding as to what the patient can handle, to be, you might say, one step in front of them, and to move slowly. And again, people take opiates particularly because life overwhelms them. Worst thing to do in a treatment is overwhelm someone.
Mm-hmm. And for the treatment provider to know what to dig and how deep to dig and when to dig. So to get a patient, that is going through detox, so is physically suffering, and put them in a group to talk about all their trauma in front of everybody else, and everybody starts digging and going deeper, it's irresponsible.
Yeah, I had a boss once who he was over an outpatient substance abuse program, and there was this big staffing meeting we had once a week, and there's a one patient who had addiction issues and other things, and people were talking about, well, we tried this series of workbooks, and we tried this kind of approach here, and this program, and we tried all these kind of, and they were all basically programs that were made already, and they were just kind of throwing the patient into it. And finally, he's a psychologist. He just spoke up, and he's like, well, I don't know, guys, heaven forbid, we need to try some psychotherapy and actually talk to this person. And
Right.
it just kind of shut everything down, of saying, like, maybe we need to get to know the person before we say, here's the 16 things that we make everybody do.
Yeah, right.
And I think that scares people off. I mean, I think one of the mistakes or traps that people can fall into is when they try something and it doesn't work, then they get the fear that treatment doesn't work. And as you always say, Claire, they may give up on treatment instead of realizing that what they need to do is give up on that particular treatment program or facility and go find effective treatment.
That would be the good news. The worst news is when, they've been through so many treatments that they feel like a failure and they stop getting treatment because they just feel they are untreatable. I think the system, we have such a loss of opportunities to help people in so many ways. David, how many times do we see parents saying, this is his last treatment, I'm not paying for another one? How many times do we hear that?
A lot.
And the sad part is this person really never received treatment. The parents paid for treatment, but the person never really received treatment. He was in a rehab for 30 days, hanging, smoking cigarettes, sitting in group. But this person has severe mental health issues, and he's never received treatment for that. So families give up on them. They give up on themselves. And that is a tremendous loss of opportunity. People that overdose and go to emergency rooms. What happened to those people? Medical help, and next morning they are out there again. So I think when somebody calls for treatment, we have to be very careful what we are promising them. We have to be very honest with ourselves, what our limitations are and what they are receiving. And I think at that point, there will be less failures from us and from them. Nobody can give you this in 30, 60, or 90 days, and it's unfair to promise.
So as we're drawn up to wrap up for today, I thought it might be good to maybe throw out one or two things that can help overcome that fear that holds people back. And maybe the first one is that I'll throw out is information. Getting good information from calling a program. I mean, like Wiseman, or calling someone who would know, and sometimes it's talking to loved ones who've been through it. I think information is a form of self-care in a way that can combat fear, especially if we try 2 or 3 sources and see what is out there,
Mm-hmm. I think we as healthcare professionals need to be humble enough and honest enough to be very clear of what we are providing and what our limitations are. I am very clear of patients. We offer them the best foot forward. We offer them a detox, a medical detox, so they can be emotionally present, and hopefully in the short amount they are with us, David, can start assessing them and have a plan forward, what they will need. If that is, psychiatrist, if there is long-term psychotherapy, if that is, finding something that is going to keep them productive in life and give them the feelings of feeling good enough for being part of society, is understanding that, the moment they are in is not who they are. It's just a moment.
That self-insight, that kind of self-reframing is another good way to battle fear, right? Is to say, this is something I'm going through. This isn't me. It doesn't define me.
Correct.
No.
Is distinguishing the person from the moment they're in.
Mm-hmm. Yes. Well, David, what do you think is a way to combat that fear?
Well, I think like you're both saying, right? And, information and a realistic understanding of what you can expect, and then delivering on that. So I think, what we do is we get people detoxed, we get them in, feeling better. We look after them physically and provide a really respectful and kind experience in which we remind them of why they made such a good decision to try to move their life in a good direction.
Mm-hmm.
And, the people that we work with are oriented that way and understand things that way, and they do. And then my job really is to help them get to know them, understand them well enough that I can provide some insight into what it is that's driving them to want to do, or needing to do the opioids. And that varies greatly depending on lots of things. But that insight then, and then sitting with them and figuring out a course of action to take what they've accomplished and move it forward and continue it in the ways that make sense. That's really, that's a profound and successful process. If someone can walk out having had that experience, that is significant. And because not only is it help them feel better about who they are, not only they accomplish what they set out to do, not only are they, off of whatever they came in on, they've had an experience in which they've been reminded of why they did it and who they are.
Mm-hmm.
And then they've got
Mm-hmm.
a course forward. If you can provide those things for people, which is really how I look at it, and I think what the two of you are saying, it's significant. And that's what we try to do. That's certainly what I try to do.
And we're going to leave it there. It's a fascinating discussion that we were able to have. I know I learned a lot about fear and facing that before we can make major life changes. As we said, information is a great source of self-care and a way to face your fears. If you or anyone that you love or that you know is looking for treatment but is holding back because of fear and anxiety, make sure to gather information, places and people who are confident and competent professionals in that area. Maybe gather from a few sources. You can, of course, always get information from the Wiseman Method. Call 1-800-423-2482 or check out our website, opiates.com. You can always hit us up on Twitter @opiates, especially if there are questions that you would like to see us talk about here on the show. Our music for the show is the song Medical by Clean Mind Sounds. The Wiseman Method, as always, is produced by Popped Collar Productions, a company specializing in the creation of your next podcast. Check us out at popcollar.net to learn more. Well, for Claire Wiseman and David Livingston, I've been Dwight Hurst. We're so grateful to have you. As always, once again, remember that when you're gathering that information, you want to keep asking questions. If you get information, if you answer your questions, you can find some hope. Have a great week. We'll be back again soon.